It's actually happy hour.
It is.
You brought something I think is it's very special to me for two reasons. One, it's from Conshohocken Brewing Company. Shout out. I can walk there. It's right on the Schuylkill River. If anyone lives around there, you can bike or run and then get a beer.
Bad that I don't even know what I bought.
little bit. But it's called Type A, which...
That's you.
I am.
That is you.
So thank you.
Well, you're welcome. It is pretty strong, so the effects are starting to kick in.
For you.
Not you? Come on.
I was just in Hawaii for 10 days, so...
Yeah. How was that?
It was beautiful.
You are more tan in person.
I am more tan. Thank you. Yes. I recommend it to everyone. Anyway, we are talking about vaccines.
Well, hopefully you listened to the last one, which was our introductory to this vaccine series. And we talked about some of the guidelines from WSAVA, from AHA. We talked about some of the vaccine reactions and how to prevent and treat them.
So if you haven't listened to the first one in the vaccine series, please go back and do so, because today's episode is all about canine vaccination. Veterinary nurses are handling these vaccines a lot of the time. So we'll talk a little bit about handling. There's some tips in there. A lot of pet owners don't know exactly what their pets are getting vaccinated for, unless it's rabies, against rabies. So I think this will be a good
And their
overview.
distemperament, of course, right?
They need their temper shot.
They need their temper shot. We'll talk about that in a little bit.
And then last but not least, which I think is important, which you brought up, is practice managers listening to this. I think this could be very helpful because it could help streamline not only your vaccine protocol, but also your inventory, which is always helpful.
That pesky inventory control.
The hardest
so
thing.
today we're talking about canine vaccine standards. Next time, tune in for feline vaccination standards. We'll hopefully be bringing in some experts from various vaccine manufacturers, talking about feline injection site sarcomas. And then, of course, your favorite topic.
Yes.
We'll be doing like a myths and facts and then a little bit of a vaccine grab bag. Yeah, that'll be sort of like the miscellaneous things that we want to talk about and maybe some of the common mistakes, common misconceptions, things like that.
Love it.
All right, so let's jump right in. I just want to preface this with everything we're telling you is based on evidence. It's based on scientific literature. The scientific literature out there, a lot of it is published. Some of it is not published. You know, some of this literature is written up, it's peer-reviewed, it's not necessarily published because it's proprietary to the companies that make these vaccines. But we do want you to understand that this is evidence-based. And so none of the stuff we talk about is just anecdotal.
And we know, and we all know out there, that there's a lot of stuff in the news about vaccines, vaccine efficacy, how vaccines are made, vaccine reactions. And so the great news, as with all human vaccines, all canine and feline and other animal vaccines are also regulated and highly, highly researched.
And if you have any questions about these guidelines, again, refer to WSAVA, which is WSAVA, or AHA, which is AAHA. They have their published vaccination guidelines, and they update them every few years.
So the last one from WSAVA was 2016, and the last one from AHA for canines was 2017. So
they're probably due for some updates soon.
Yes, I'm sure they're going over that right now.
All right, so what we didn't talk about in the introductory podcast on vaccines was really just like the types of vaccines. So why don't we continue from there and talk about the different types of vaccines and how they differ from one another and why we use different types of vaccines.
Once again, I think we said this in the last episode, is that both of us hated immunology as a course in vet school. And so we are not talking about these, quote, types of vaccines to get very deep and scientific, but I do think it's very important for us to know how vaccines work on a basic level so we can help our clients and tell them what to expect. So in veterinary medicine, we have 3 different, quote, types of vaccines. The 2 most common ones that we're very familiar with are the inactivated vaccines. Those are the killed vaccines. All canine rabies vaccines are killed. Then the second major type is attenuated vaccines, or the modified live vaccines. And then the third big type of vaccine in veterinary medicine are recombinant vaccines. And these are genetically engineered, or DNA vaccines. There are 2 other ones that we're not really going to jump into, but maybe if you guys do want to talk about these last 2, give us a shout at clinical@indevets.com. and let us know. But there is a type of vaccine called a Toxoid Vaccine, and that's a detoxified toxin. We're all familiar with the Rattlesnake Vaccine. We don't have it up here in the Northeast, but I have worked in Texas where we've used some of it, and so that's not as common up in this area. And then the last type of, quote, vaccine is something we're all hearing about now, which are the therapeutic biologics or the therapeutic vaccines. And one of those is Cytopoint. So the monoclonal antibodies are considered therapeutic vaccines. And then in that same category are the cancer vaccines, right? Like the melanoma vaccines and the osteosarc vaccines. But they actually use the patient's own tumor to then make a vaccine, which is awesome.
That's cool. And of course, like in human medicine now, we have the mRNA vaccines,
exactly.
But not yet in pet medicine. Yeah, so let's start with the killed ones.
So the killed ones, those are really stable preparations of like whole viruses or whole bacteria, and they can't replicate. We're giving you literally a killed version of the rabies virus, but it can't replicate. It can't give you rabies. They're very safe. Two slightly negatives of a killed vaccine, though, are they're less immunogenic. So they don't last as long.
Well, they're not replicating in the body.
Right. And so they tend not to have like an extended duration of immunity. And then secondly, which I think you'll speak a little bit about your own personal experience, but a lot of these killed vaccines have an adjuvant in them, which incites local inflammation more and enhances the immune response. But you can see anecdotally and also in the research more side effects, like local side effects. So what's been your experience with that?
Yeah, I often see pets come back in a couple weeks after getting the rabies vaccine, and they'll have a lump in that right rear, in the hip or the upper leg. And I think that's because of this adjuvant that you're talking about. The rabies vaccine is a killed vaccine. We'll talk about that a little bit. But that adjuvant that's in there really incites that local inflammation, and you get these granulomas that form, and people sometimes mistake them for a tumor of some kind.
Yeah, I guess you're right. You can see a lot of injection site pain, granuloma formation, and you can get like the swelling that we talked about in the last episode, like angioedema. And so some common vaccines that we all know of that are killed or inactivated are, like I said before, all canine rabies vaccines and all the whole cell bacterin vaccines. So all of the leptos, some of the Lymes, which we'll talk about a little bit later in this podcast, the sub-Q Bordetella, all the influenza vaccines, and then some cat leukemia vaccines, which we'll talk about in a different episode.
That's great. Well, then, you've got some killed, and then you've got some modified live or these attenuated vaccines. And those, I'm assuming, are the rest of them.
Yeah, the major ones.
The major ones.
Yeah. So
other than the recombinants.
Right. The modified lives mimic natural infection, but they can't produce disease in the body. And so they're very highly immunogenic. So you get that sustained immune response a lot of the time with just one dose. And we can talk about when one dose of these vaccines is appropriate, not as puppies, not as young puppies, but these are the oral or intranasal administered vaccines like the Borditellas, most canine distemper virus vaccines, and all the canine Parvo and adenovirus type 2 vaccines.
So the last one that you wanted to talk about was the recombinant ones, right? The genetically engineered vaccines. And those, I'm assuming, are the more recent in technology. They're becoming more popular, more expensive too.
That's true. And there's a lot of sub-versions of the recombinant vaccines. So we all know this, right? We all have seen on vaccines canary pox, right? So canary pox is a vectored vaccine. So a virus vectored vaccine is a type of recombinant vaccine. Subunit vaccines are recombinant vaccines, and chimeric vaccines are recombinant. So what does that mean, right? I mean, really, this helps me remember it. So recomb means recombine. What they actually do is they take out very specific portions of the pathogen's DNA or RNA, isolate them, and remove them from the disease-producing microbe. Then they recombine that portion of the microbe with a non-pathogenic organism like canary pox. So canary pox is non-pathogenic, but it can hold that small little piece of DNA.
Yeah.
And so that's where you get the recombined, quote, or recombinant canine distemper that has a canary pox vector. That's where you can get the recombinant feline rabies, which has a canary pox vector. And then the ones that we all know, right, the Lyme disease ones, we've all heard talk about OSP-A and OSP-C, which we will talk about a little bit later. But those are very, very specific portions of Lyme disease. So they're pulling out these little subunits of the OSP-A for Lyme disease and recombining that with something.
So these are, you can, for most of us that have been following COVID and this mRNA thing, I'm not going to get into that, but, this seems almost like the precursor to that. This is like what they were doing right before.
Right, like a little piece.
Yeah, these little pieces, these very highly specific pieces that cause an immune response in the body against these very specific pieces of protein.
Yep.
That these terrible diseases in dogs carry. So,
right. Like if you, for example, like the chimeric, which is the one that's like unheard of to all of us, right? That's like a very small antigen, and they can be immunizing as well. But those are the OSP-Cs and the OSP-As for Lyme disease. And if you can target just one piece and the body can crush that part of it, the Lyme disease can't replicate in the body. So
we'll get to that more when we talk about Lyme.
Absolutely. So those are the three major types of vaccines. So you know a little bit about how they work. And if you think about it, if anyone asks you a question like, is this safe in a pregnant dog? Or is this safe for a dog like this? Or is this safe for a cat? You can kind of think, okay, what type of vaccine is it?
If you understand how it works, then it should help you determine the efficacy and the safety.
Absolutely.
Perfect.
Yeah.
Perfect.
All right. So let's jump into vaccination schedules or standards, protocols for dogs.
I think it's important to set the tone here and explain to people who don't know this that when puppies are born, they start to drink the colostrum and the milk from their mothers, and they actually get maternal antibodies that are floating around in their bloodstream. There's a point in time in the first few days of their existence that when they drink the milk, they actually bring those antibodies right into their bloodstream. And so they float around up to about 16 weeks. Now, we don't know exactly when those antibodies are going to go away. Sometimes they go away around 10 weeks. Sometimes they go away around 20 weeks even. Mm-hmm. They've been shown to last that long. So what we need to do is we need to vaccinate these puppies every few weeks up until the point where those maternal antibodies are no longer present, because they cannot create their own immune responses until those mothers' antibodies are gone. And so that is the reason why your puppy needs a vaccine every few weeks. It's not because these vaccines require several injections. It's because we don't know when they're actually going to work.
Right.
And we know that 95% of pets won't have maternal antibodies at 16 weeks. So we're usually pretty good about stopping at that point. But some people are pushing to 20 weeks because they want to get that last 5%. They want to make sure that everybody's covered.
Yeah.
I think it's worked in the past because of the herd immunity. If 95% are immunized by 16 weeks, it's fine. But I think we are forgetting about a few pets, that 5% or so that really just don't get that effective immunity, and probably until the next year.
Yeah. And I think it's great that you mentioned why puppies need multiple vaccines. And so this should have been part of the myth and grab bag one, but I can't help but say one of my biggest peeves is when people are like, well, this is his third distemper shot, so he's done, right? It's not about the number of boosters your puppy gets. It's when they get the last one and how old they are. Yeah. So I stress that, like, some puppies, if their breeder started them at 5 or 6 weeks, they're going to have more distemper vaccines than a puppy who started at 10 weeks.
And if you adopt a pet and they happen to be 16 weeks or older and they haven't had a vaccine, for a lot of these vaccines, they could have one and be okay.
Right. So it's very individualized.
Yeah, especially the modified live ones.
Yes.
And the rabies, of course, which we'll talk about too. So yes, that's why we repeat these things every 3 to 4 weeks until those antibodies drop below that threshold.
So let's talk about the available vaccines that are recommended by AAHA and WSAVA for canines.
Sure. I think it's important to break them up into what we call core vaccines and then non-core vaccines. Core vaccines are vaccines that you want to give anywhere you live. It doesn't matter what the lifestyle of the dog is. These are vaccines that the community, the scientific community and the veterinary community feels are very, very important and should be given to all dogs no matter what. So this is rabies, which is not only for their health, but it's actually a public health issue.
Rabies is still a fatal disease in any animal that gets it. There is no treatment, although some people have survived.
Yeah.
But it is still fatal.
And of course, we've got the other ones that everybody knows too, which is the Distemper Vaccine, which is actually not just distemper. It's at least 4 different diseases in the Distemper Vaccine. Some know it as the DHPP. Some know it as the DA2PP. So the D is distemper. The H or the A2 is the hepatitis or adenovirus 2. And then the 2 Ps are parvovirus and parainfluenza.
And then we have a debate going here. In some areas, we consider Leptospirosis vaccine a core now.
Yeah. You have to ask the question, is this something that should be given no matter where you live? And it's becoming clear that it's becoming, yes, I think that's why it's sort of on the cusp of being a core vaccine, is that we realize leptospirosis is affecting pets in almost any part of the country at this point. And whether you're an indoor dog, whether you're an outdoor dog, this is something that you're potentially exposed to. And for those who don't know, leptospirosis is carried by small mammals like rats, mice, possums, but it's also shed and it lives in moist environments. So if you're living in Manhattan, and you've got a mouse problem, your dog could theoretically get it. If you're living in, the tropics, obviously that makes sense, right? It's a moist environment. It's going to live long. So we can talk more about that one. So
I think that's a really good point. We used to only vaccinate like suburban and very rural dogs for lepto, but now we realize we left out all those city dogs and now they're getting lepto because you're absolutely right. Rats and mice are a big carrier of lepto. So vaccinate your patients for lepto.
All dogs should probably get leptospirosis at this point.
Agreed. All right.
The vaccine, at least.
All dogs should get leptospirosis vaccine. Correct. That's like that's another grab bag. Marissa's pet peeves. When people say, did you give it rabies? No, I didn't. I gave it a rabies vaccine.
Yes.
Semantics.
Well, let's talk about the rabies vaccine. I think this is a really fun one to talk about. And I think there's some misconceptions here. For instance, on the label of the rabies vaccine, you might see a 3-year label and you might see a 1-year label. All of my research, and Marissa, your research as well, has shown that there's actually no difference in most cases. There's no difference between a 3-year and a 1-year rabies vaccine. So you shouldn't be paying more for a 3-year versus a 1-year. These vaccines are still required yearly for that first year, and then every 3 years for dogs going forward. And that's by law in every state.
We recommend that if you had to carry one rabies vaccine for dogs, it would be the 3-year because they're essentially the same. As we discussed briefly before, the minimum age for rabies is usually 12 weeks, but state and local requirements vary. And so you should just make sure that you know your own minimums. That being said, a lot of us in the veterinary profession now are pushing out the rabies vaccine to give with the last DA2PP vaccine. So we're giving it closer to 16 weeks of age. And our reasoning for that, and my own included and yours as well, is that we want the maternal antibody to be weaned as much as possible before we hit them with that one rabies vaccine, right? Because we're not boostering it. No matter how many times I want to. We are only giving one rabies vaccine to puppies, and it is good for 1 year. Once again, like I said, we're usually giving it around 15, 16 weeks of age. I have had, in my 11-year career, a lot of people bring in dogs from breeders where the breeder has said, wait until 6 months to give the rabies vaccine.
Why would they say that?
Look at my face. I don't know. I don't know. And there is no evidence from AHA or SAVA or anyone to wait until 6 months to start or to give a rabies vaccine. So I just want to make that a little bit clear.
Yeah, and I think we all know puppies bite and they're constantly gnawing on our hands and they're nipping at people. You certainly want them protected as early as possible so that you're protected.
Yep. So another soapbox I have about the rabies vaccine is when I became a vet, there were no state exemptions allowed. Like everyone had to get a rabies virus vaccine. And probably about halfway through, like maybe, 7 years ago or so, Pennsylvania at least started allowing an exemption, right? Only from veterinarians. If an animal, had anaphylaxis and almost died from a rabies vaccine, you could exempt them. But there was a whole process where you had to write a letter, you had to send it to the state, it had to be on file, it had to be sent every year. And what people didn't understand is they're like, oh, okay, well, like my pet's been exempt. That doesn't actually mean anything.
Right.
So like,
doesn't mean they're safe.
It doesn't mean they're safe at all. And so if your dog was bitten or did the biting, you would still be subjected to a specific quarantine by the Department of Agriculture or the Department of Health based on the scenario. But you can be exempt if you don't want your animal to get a rabies vaccine, but that doesn't mean that they're not going to have to go through a 6-month quarantine.
All right. Well, I think we've exhausted the rabies.
I think we
discussion.
beat the rabies
We beat
to death.
it down. Let's talk about the next big one, and that's the DHPP, the distemper, hepatitis, parvo, para-influenza. So parvo and distemper are the two most important infectious diseases for dogs. That's why we really feel strongly about this vaccine. Rabies, like I said, is really the public health thing. This is the first vaccine that's really for our pets. These are not diseases that humans get, but these are diseases that are very common if not treated. We know that in America, in most communities, there's minimal amounts of these things, but they still are seen. And unfortunately, we still lose a lot of dogs to these diseases.
Oh, yeah. And there's huge pockets. I mean, I stress this, right? DA2PP, if dogs are appropriately vaccinated, it basically has eliminated this disease. But I've practiced in Texas where Parvo was huge. And to me, I was very confused because it is a highly preventable disease if given, if the vaccines are given appropriately. So it is still out there a lot.
Yeah. And for the non-vets out there, I just want to say distemper has nothing to do with your dog's temperament.
Nothing.
Okay?
Nothing.
So this is just the name of the virus, distemper. It doesn't cause a distemperament if they get it. It's actually much worse than that.
Much worse.
much worse than that, which we won't get into. Just vaccinate, okay? Vaccinate for this. It's still a very fatal disease, most commonly fatal. Now, parvo can also be fatal, especially when not treated. If you catch parvo early enough, if you give it the proper treatment, which is not a cheap treatment.
Not at all.
It is still treatable, but I would say, I think the going statistic is 50-50.
Yeah, and it's an intense treatment.
It's intense, and it's certainly not something you want to watch your little puppies go through.
Certainly the vaccine is much cheaper. So other than distemper and parvovirus, what are the other two viruses that are covered in the DA2PP vaccine?
Well, we've got the hepatitis, which is the adenovirus 2, and we've also got para-influenza. And adenovirus is something, again, we don't see that often. But when we do, we usually see the respiratory version, which is the canine adenovirus 2. It's the part of the canine infectious respiratory disease syndrome. And we won't go too in-depth on this, but they used to call it blue eye because it would cause like an allergic uveitis. And again, you see that in puppies, you should be strongly suspicious of this disease. But because most people are vaccinating for this, it is going away, which is great. I
tell people, very importantly, that adenovirus 2 and parainfluenza are two viruses that cause kennel cough, which people don't realize, right? Because everyone has thought, this is another Marisa soapbox, the Bordetella vaccine is not the kennel cough vaccine. Kennel cough is an umbrella term.
It's a whole syndrome.
It's a whole syndrome. And parainfluenza virus and adenovirus 2, the respiratory version, are both causes of kennel cough.
And so Bordetella is just an add-on to that.
Correct. Bordetella is a bacterial cause of kennel cough, but these two are viral causes. So I always, when I'm educating clients, I'm like, all of this is important, especially if your dogs are going to see other dogs. How are we vaccinating for DA2PP?
Well, if they're puppies, they follow the puppy schedule, which what we talked about is every 3 weeks until 16 to 20 weeks. After that, we wait a year, we do it again. And then every 3 years is the way that the WSAVA and AHA recommend.
And what if you see a patient that you don't know how old it is, right? So first you see a patient that's under 20 weeks of age and it's never had a DA2PP. And then you see a patient that's over 20 weeks and it's never had a DA2PP. How many do you need to give?
1, as long as they are past 16 weeks.
Right. So if they're under
16 weeks, you should give 2.
Right.
If they're past 16 weeks, 1 should be sufficient for that first injection.
Yep.
Perfect. All right, so let's finally talk about leptospirosis. This is the more interesting one. We've talked about it a little bit. Leptospirosis, for those of you who don't know, it's not a virus. It's not it is a bacteria. It's a certain kind of bacteria. It's a spirochete, which it's very difficult to grow in culture. So it's very difficult to diagnose, actually. You find it in the urine of dogs, but it's not something that you can just put on a plate and grow. So it does require some specialized tests, which make it very difficult to diagnose.
Yes.
Which is why you should just vaccinate so that we can cross that off the list when they show up with these signs.
Hopefully. And the vaccine, it covers for how many different leptos?
4.
Yes. So the original Lepto vaccine had 2 serovars in it, the most common. But since I've been a veterinarian, there have been 4 serovars. I haven't seen the 2 serovar one in a long time, so I'm hoping that everyone is using the 4-way.
Now, the one thing that differs in the Lepto vaccine versus the distemper is that you have to give it every year. So you give it once, you give it again 3 to 4 weeks later as a booster, anytime really within 6 weeks. But we always tell our clients come back 3 to 4 weeks later. And then they've got to do it every year to keep up with it. If they don't get it boosted within 15 months, they've got to restart the whole double shot process, unfortunately. Right. And this is always a tough conversation when people come in and it's been 18 months or longer, and you say, we really need to restart. So you have to come back again in 3 to 4 weeks.
Yes, and this is another tough one. You're absolutely right, because the research is not there to show how long, like, we know the duration of immunity is at least a year. We don't know how long it is. And so that 15-month mark or the 18-month mark or whatever we've heard, the 15-month mark comes from the vaccine manufacturer, basically, that says, these are our recommendations. And if you don't vaccinate to our standard or to our recommendations, if for some reason that pet gets lepto, the actual disease, they won't cover treatment. But if my dog is perfectly vaccinated for lepto, still gets lepto, they're going to cover that treatment. So I always recommend following the vaccine manufacturer's recommendations.
Yeah, why not?
Yeah.
It's an extra insurance.
And also known about lepto is no matter how old you are, you need 2 vaccines 3 to 4 weeks apart to start the series.
Right.
And then every year.
So for a long time, I thought that you couldn't give lepto and Lyme vaccines before 12 weeks of age. Now it seems they've changed that recommendation. They say anytime after 8 weeks.
Correct. All right, on to the non-core vaccines.
Yeah, these are the optional ones.
My dog has all of these.
Mine too.
Yes.
But what makes it non-core is that this is based on the lifestyle of your pet. It's based on the geography of where your pet lives, where you live. Let's talk about the first one, which is Lyme disease. Clearly, Lyme disease is not a disease found all across the country. We interview people in Florida all the time, and we're like, tell us about your Lyme disease protocols. And like,
we don't have them.
We don't know.
For now.
Yeah, for now.
Yeah.
That's a good point. You know, all these diseases are certainly spreading around the country more than ever. Okay, so there's an old Lyme vaccine. There's a new Lyme vaccine. I think you already talked about recombinant vaccine. So I think this is the first time we actually get to explain it a little bit more.
Yes.
So tell us a little bit about the Lyme vaccine. Tell me everything you know about Lyme.
Ooh, that's a loaded question. I'll try to make this short and sweet, but honestly, you guys, if you do want more information on the Lyme vaccine, we could probably do a whole podcast on it, and we will get some experts on. So please hit me up at clinical@IndeVets.com and let us know. But my experience with the Lyme vaccine more recently is the CR Lyme, chimeric recombinant, as we talked about earlier. That's the CR and the CR Lyme. The vaccine is focused on the outer surface protein of the Lyme disease, of Borrelia, which is a bacteria, OSP-A and OSP-C. Those are the outer surface proteins A and C. So it's a very specific vaccine to these outer surface proteins. And then the old Lyme was a bacterin, so it didn't have the full coverage of both of those surface proteins. So right now I'm most familiar with the CR Lyme. All of the Lymes, no matter what, do require a booster 3 to 4 weeks after the first shot, no matter how old you are. And then the vaccine is given yearly from then on. Just like the Lepto vaccine, you're going to look for your manufacturer's recommendations. But typically, if it's been longer than 15 months since the last vaccine, I will restart the series, especially with Lyme. And that's because Lyme is not 100% vaccine. And you can have the Lyme vaccine and you can be on tick preventative every month, and you can still be exposed to Lyme. And so it's a really good idea to follow the vaccine manufacturer's recommendations, because they'll pay for all the testing, they'll pay for all the treatment.
You know what I always find? People who've had Lyme disease are the first ones to be like, yes, get that for my dog. Because it's such a terrible disease. And a lot of times it's like just hard to figure out because it's got such weird, non-specific symptoms. But it's a really cool vaccine, this new CR Lyme vaccine. And I really recommend people look into the OSP-A and OSP-C. It's really cool. Like the OSP-A, part of it prevents the transmission from the tick into the dog. And then the OSP-C sort of targets the protein when it's in the dog. And it's actually really, really cool science and really cool technology that they've come up with. So kudos to to whoever figured that one out.
Oh, yes, true. Well, Zoetis sells it. Good for them.
Yeah. All right, so let's move on to Bordetella. Bordetella is the kennel cough vaccine. Everybody knows it as that, and Marissa already just schooled us on that.
No, it is not.
Right, it's not. It's not. And there are lots of different ways you can give it. You can give it intranasally, so down the nose as a squirt. You can put it in the mouth. That's a different formulation, by the way. And then there's an injectable version, which is a completely different formulation. And it's really important that you don't mix and match, that you look at the label and you say, this one is intranasal, this one is injectable. There have been really bad cases of people injecting an intranasal because the intranasal is a live vaccine.
Correct.
And the injectable is a killed vaccine. And so it's really, really important. Every time I get Bordetella, I stare at it and I look at it and even though the technician hands it to me, I'm just like, what is this? I look at it, I make sure because I really need to know. I guess it would be probably okay if you squirted a killed vaccine down the nose, but it just wouldn't do anything.
It wouldn't do anything. And I especially, we work with IndeVets, 100 of them, and we go to different hospitals every week. And so Bordetella has been my nemesis. Yeah. Like the amount of time I stare at a Bordetella label.
They probably think I'm crazy. I'm like, is this intranasal? Is this oral? Is this?
I ask like 4 times too, but I can't stress, know what's in your Bordetella vaccine, know where you're giving it, and then document how you gave it.
Absolutely. Absolutely. For a long time, I've been in a lot of places, they advocate for giving this every 6 months. And what's annoying is a lot of places will allow boarding facilities to dictate to them how often these
without
vaccines,
any science.
Without any science. And like people will say, oh, well, my boarding facility, my daycare says I need to give it every 6 months. And it's like, no, the AHA guidelines, the WSAVA guidelines, everybody says this is a yearly vaccine. The manufacturers say it lasts a year. Just give it once a year.
Yes.
Okay.
No known value.
And if you're getting a lot of requests from boarding facilities that are forcing you to do it every 6 months, call them and have a talk with them. And maybe they'll change, actually. I actually did that once.
Me too.
Yeah.
Me too. I was like, there's no reason. And it's a waste of money for clients, honestly. And it's hard for me to tell clients why that's required. Scientifically, it shouldn't be.
And one thing we talked about, this is a non-core vaccine because this is a lifestyle vaccine. This is a disease that's highly prevalent in boarding facilities, in indoor environments where you've got multiple dogs. I always recommend that pets do this for the first couple of years of their life, no matter what, just to get some immunities in them. And then after that, I say it's kind of an optional thing.
I recommend it for all puppies because, one, I hope and assume that all puppies are going to take a puppy class, right?
Or at least be social.
Or at least be socialized. And then it's also the most serious disease in puppies, right? It can cause pneumonia more easily in puppies. And so that's how I explain it to people. It's like we're going to give one as a puppy and hopefully one at their yearly exam. And then depending on their lifestyle, you can choose how you're going to go forward with that.
Yeah, and I think what's nice about Bordetella, just to finish off Bordetella, it's nice that they have different ways that you can give it, the intranasal, the oral. You have to have the different kinds, of course, but some dogs are just really not good with anything in their face.
Yeah.
So it's nice to have that option in your practice if you have the injectable version. But just make sure you look at the label.
Yeah. And 2 important things about the intranasal Bordetella. 1, some have para-influenza virus in it as well. Yeah. And so I will reiterate, know what's in your Bordetella vaccine. And if it has para-influenza in it too, research has shown that giving the para-influenza intranasally actually provides better immunity when it's given sub-Q with the DA2PP vaccine. So I've always liked that well-rounded vaccine protocol.
News you can use.
Dork.
So the one thing about the subcutaneous, the injectable version of the Bordetella is that it does require 2 doses 3 to 4 weeks apart, just like any other killed vaccine other than rabies.
We're getting down to the less and less common ones, but dogs do have an influenza, just like most species have an influenza for them. And so dogs, there is a high morbidity but a low mortality for influenza in dogs, especially in like kennel situations or breeding situations. If your dog is going to be in a lot of those situations, we recommend influenza.
And this is not a zoonotic influenza, right? Like the canine influenza is not something humans can get.
Correct. And just like human influenza, when this vaccine first came out, it was one strain. It was the H3N2. Then we found out there was another common strain of influenza in dogs, which is the H3N8. And now, a few years back, they came out with the combo of both strains. And so that's what I'm seeing mostly in hospitals now, which is the combo.
You like this vaccine. You give this out.
Yeah, I give it. Lois Lane has it.
And, we were just talking about how this influenza is not zoonotic. I forgot we didn't mention with lepto that lepto is zoonotic. And for those of you who are not in the scientific world, zoonotic means people can get it too. So if your pet gets leptospirosis, it comes out in their urine, and in theory, you can get it if you're handling that urine. So Correct. Another reason to vaccinate for it. Just wanted to
Thank you for that aside. We totally forgot that. Okay. So influenza vaccine in dogs, the combo or the singular strain, when you start it, no matter how old you are, you need 2 boosters, 2 to 4 weeks apart, and then it is given every year. And what I also like to tell clients is just like our flu vaccine, just like our coronavirus vaccine, dogs can still get the flu even if they're vaccinated. It's just that they're likely not going to die from it. So we want to make sure we're telling them what to expect.
Right.
All right. The last vaccine that we don't use at all up here, but people who may be listening may use, the rattlesnake.
This one's all you because I know nothing about it since I didn't live in Texas.
Well, it's a toxoid vaccine like we talked about, right? It's a deactivated toxin, and we only give it to dogs that have a risk. So hunting and hiking dogs in areas where farm dogs, where there are rattlesnakes. It is given subcutaneously, and the weird part about it is like the dosing and the frequency varies among dogs, like based on their exposure risk. So like bigger dogs who are out and about more frequently are going to get this more frequently, like every 6 months. So I would also like to hear from anyone who's had some rattlesnake vaccine experience. If you want to hit up clinical@IndeVets.com.
I'm sure our IndeVets have some experience with that.
That's true.
We should ask them.
Absolutely.
All right. So the last one I know is near and dear to your heart. The coronavirus vaccine.
No, we're not talking about COVID-19.
No, it has nothing to do with that. This is a vaccine that's been around for years and years and has fallen in its...
it's not favored.
It's not favored, right.
No.
It's not favored. So talk a little bit about this one, because I know you've encountered it at certain practices that you've been at, and you sit there and scratch your head a little bit.
Yes, I scratch my head a lot, actually. It's not. So we're all now familiar with coronavirus in the mainstream because of COVID-19. But in veterinary medicine, we're very familiar with canine coronaviruses and especially feline coronaviruses, which we'll talk about next time.
And these are mostly GI diseases.
Correct. Yes. In dogs and cats, mostly GI related. But there is a vaccine for both canine and feline coronavirus. However, it is not recommended by AHA as core or non-core. It's not recommended by WSAVA at all. And especially for AHA has a disclaimer kind of in their guidelines, which says like the coronavirus vaccine for dogs is not recommended on the grounds that the infection causes mild or subclinical disease. It generally only occurs in dogs 6 weeks of age or younger, AKA we haven't seen them yet,
right,
and is typically self-limiting. This is why anytime I see a coronavirus vaccine being given, I'm like, I'm not sure why. And if you search VIN or you listen to vaccine lectures, the quote is like, coronavirus vaccine is a vaccine looking for a disease. It really isn't doing much.
It could provide more harm than good.
Yeah. I mean, right. And a vaccine, any vaccine is not benign. So we need to know there are coronaviruses in our pets, but you're not going to get them and you do not need to vaccinate for them.
Great. I think that pretty much sums up the major canine vaccination protocols.
Pretty much all of them.
If we missed one, definitely let us know. I think Marissa's mentioned our email address a few times now, so hopefully you get that. But anyway, I just want to thank everybody for listening. I want to thank Marisa for letting me come to your house again.
Thanks for the beer, Andrew.
Drink beer. You're welcome. This one was good.
Yeah, thanks so much for only bringing one for me. Appreciate
it's
that.
7%. How many do you want?
I mean, a few.
Well, you can clearly hear that I've had mine. So tell your friends about us. And that's vets, that's techs, that's anyone who thinks they can get something out of this. Other than this one, it's usually short enough to listen in your commute.
This is commute to and from.
To and from. All right. So this one, you're going to have to break it up. Exactly. But you found us on whatever platform you found us on, but you can tell people we're on Spotify, we're on Apple, we're on Anchor, etc. And if you do like us, leave us a review, make a comment, subscribe so you can be alerted whenever we have a new episode. And right now we're doing episodes every 1st and 15th of the month. All right. Well, Marisa, cheers.
Cheers. 5 stars, guys. 5 stars.